Hello students, welcome to this lecture. Protocol schedule, cycles, end of treatment and follow-up. So do you remember randomization and drug assignment that happened on 25th January 2019. So each cycle repeats every 28 days. That's how cancer therapy works. You consider it as a cycle. So you calculate 28 days and cycle 2 will fall on 22nd February 2019. So that is also a Friday. So this makes it very easy for the patient, right? So what happens is the coordinator will look at the schedule, look at possible dates and speak to the patient and say, hey, can you come on this date? And if all agreed, the visit is scheduled. So that's how it happens. And cycle 2, then cycle 3 will happen in March in another 28 days, cycle 4 in April, and cycle 5 in May, and you go on, right, until end of study is reached. So end of study is determined by the medical monitor and the sponsor and everybody, but right at this moment we don't know when it is. So let's look at what are the assessments done as part of each cycle. So medical and surgical history. So that because these are very sick patients, so you need to know what are the other conditions the patient is having, right? So a heart attack, bowel syndromes, you name it, right? Then physical examination and vital signs. Physical means the doctor will palpate, see the lymph nodes, spleen, liver, and so forth. Vital sign means temperature, pulse, and breathing rate, and so on. Then ECOG performance status, that is the functionality of the patient for cancer patients. Then hematology and chemistry. Hematology means number of red blood cells, white blood cell, platelets, and so forth, which measures blood function. And serum chemistry, electrolytes, sodium, potassium, ALT, AST, which are markers of liver and liver disease. It's also checked. And then you also do urinalysis, then thromboplastin and prothrombin and thromboplastin time, which is a marker of blood coagulation. Then you also do a ECG every 4 weeks because you need to know what effect the drug has on the function of the heart. And then plasma sample is taken for exploratory biomarker analysis. That means you see whether the biomarkers from the cancer released to the blood, what happens in response to the drug, right? Then plasma sample for steady state imaging concentration. That's our drug because the drug is taken orally, but it goes to the blood and you want to see what concentration is there in the blood every cycle, right? Whether it changes or not. And then you do patient reported outcomes because currently it's all about patient well-being. So how do we measure patient well-being? By giving a questionnaire to the patient. And also every 8 weeks you do pregnancy test because you can't do pregnancy test every 4 weeks, right? So every 8 weeks. And you do a CT and MRI scan of the cancer, the lungs, to see how it's doing in response to the drug. And also you do MRI of the brain where the cancer has metastasized to the brain to see how it's responding to the drug as well. So that is every 4 weeks and every 8 weeks. That's how it is done. And I have to mention that CONMEDs and adverse events are done throughout the study because not all the drugs are allowed when you're on a clinical trial drug because it interacts with the clinical trial drug. So you need to keep a close look on the CONMEDs. That means concomitant medications that the patient is on. And adverse events are also measured and recorded so that we have oversight, right? Then let's say the patient did cycles, cycle 1, 2, 3, 4. So January 7 to 2019 to 2020 is 12 cycles, 12 months. So 2020 to 2021, another 12 cycles. So altogether 24 cycles. Then January, February, March, April, May, June, July, September, October, 10 months. So 12 plus 12, 24, 24 plus 10, 34. 34th cycle will happen on 25th October 2021. So that's the end of the treatment visit, right? So you can always work out the dates and the cycle number. So what happens at the end of the treatment visit? So you need to do a visit 30 days after end of the treatment visit. So what's checked at 30 days after end of the treatment visit? You do a ECG. How is the patient's heart doing after you withdraw the drug? And also you do a patient reported outcome right? So 30 days from 25th October falls, and also you do patient reported outcome questionnaire, right? So that is the 30 days after last dose. And also you do continuous follow-up after that, right? For 2 years. Every 3 months you need to make a phone call and check for survival status of the patient, as well as what other anti-cancer medication the patient is on, because we are interested in that. And there's a window of 14 days, plus or minus 14 days for these follow-up calls. And this data will be very useful, right? Because it enlightens us whether the drug had an effect on the patient's survival in the long term. For 2 years, when the patient are surviving, you can compare the drug against the placebo. So that is the end of the drug protocol schedule. Protocol schedule cyclic visits, end of treatment, and follow-up. So I have given a copy of the protocol schedule, and I'll be giving you some hands-on experience questions as well. So you'll have to work through it. So you have to figure out which day the visit is on and what assessments are to be done and so forth. So that's the end of the lecture. Ciao.